In today's video, I'm going to talk to you about looking after your hands when you have osteoarthritis. My name is Paula and I'm an occupational therapist working at Tallaght University Hospital. If you're not currently under the care of an occupational therapist but you would like to be, discuss this with your medical team or your GP at your next appointment and they can make a referral for you. Otherwise, check at your local primary care centre to find out about local services, or if you wish to access a private occupational therapist, look at the website aoti.ie and you can find the information there. So let's start by asking, what is arthritis? Well, arthritis is not one single condition, it's an umbrella term used to describe several different conditions. So you may have heard of rheumatoid arthritis, gout, osteoarthritis, ankylosing spondylitis. These are all types of arthritis, and today we're going to look specifically at osteoarthritis. You also may wonder why you would benefit from seeing an occupational therapist when you have osteoarthritis. Well, if your joints are sore, stiff, or swollen, this can impact on your ability to carry out your daily activities. And the primary goal of occupational therapy is to enable you to be as independent as possible in your day-to-day activities. So if you have difficulties with writing, cooking, going to the gym, maybe looking after your children, or performing a task in your workplace, occupational therapy can help you. We can help you to adapt your daily tasks so that you can continue doing what makes you you. These may be things that you need to do, like working or dressing, or maybe things that you like to do, like knitting or playing your sport. So who gets osteoarthritis? Well, we know that it is more common in the over 40s, and we believe that it is a normal part of aging. So aspects such as delayed healing can impact. It's more common in women and can often appear after menopause. Being overweight can make you more likely to get osteoarthritis, but this is more relevant in weight-bearing joints such as hips and knees. There's often a family history with osteoarthritis. So in the same way that we inherit our parents' eye colour or complexion, we can inherit their joints too. And if you've had a previous injury to a joint, in certain circumstances, this may make you more prone to osteoarthritis. In this first picture, you can see the pink healthy cartilage. It's a smooth, strong, protective layer that covers the ends of the bone. Osteoarthritis starts with the roughening and deterioration of this cartilage. Your body then starts a repair process to try to make up for the loss of this important substance. As a result of this, tiny bits of extra bone called osteophytes can grow. This can change the appearance of a joint and make it look a little wider and bumpy. There can also be an increase in the amount of thick fluid inside the joint to provide extra cushioning. And then as a result, the joint capsule can stretch and the joint may lose its shape and stability. In reality, what this all means for you is that the appearance and stability of your joints may change from what has been normal for you in the past. And this can happen gradually over several years, or for some people over a shorter period of time. The good news is that the moment you become aware of the symptoms, you can start to help yourself. We can make smarter choices to minimize the effect of the osteoarthritis on your joints in the longer term. The main symptoms that people describe are stiff and painful joints that can often feel a little bit more symptomatic after a busy activity or at the end of the day. It usually improves with rest, but over time you may find that your joints don't move as freely as they did before, or they might creak or crack a little bit on motion. The symptoms can be very mild, hardly noticeable, to severe, and people often tell us that they go through good spells and bad. And this can be to do with what you have been doing with your hands in the previous few days, or indeed sometimes to do with the weather, and there is evidence to say that the weather can impact on your symptoms. Osteoarthritis in your hands can be particularly challenging because daily activities can become difficult and you can start to feel that your daily tasks can increase the pain and strain on your joints. For women, it's particularly noticeable in the base of the thumb, and that can affect activities where you have to twist or pinch. You can also experience arthritis in the tips of your fingers, where you can see little nodes or bony bumps, and writing or picking up small items can affect this. But osteoarthritis can occur in any joints in the hand. It is also important to acknowledge the emotional impact of osteoarthritis, as it impacts on your independence in routine tasks. This also impacts on your emotional well-being. You're also trying to cope with pain and fatigue, which can add to the challenge. People often tell us that they feel frustrated or angry because they can't do things in the way that they used to do. So whether that means that you can't keep on top of your garden as well as you would like, or that you feel less capable in your workplace, it's important to acknowledge this as another normal symptom of osteoarthritis. So let's look at what treatments are available and what you can do yourself to help your symptoms. So your doctor may prescribe some medications such as paracetamol, or may advise anti-inflammatory gels or steroid injections to help with your symptoms. And in severe cases, surgery is an option as well. But what can you apply at home that will help as well? So some people find that cold therapy can help to relieve pain. So you can achieve this with a cold water basin, with ice packs, or with something like this, which is a cold gel that can be massaged into the affected joint. And this can give you a temporary anesthetic relief, which can be pain relieving. A lot of people will also find that heat can be relieving, particularly for stiff and painful joints. So let's think of some of the ways that you can apply heat treatment at home. You can use a basin of warm water, and in the water you can gently open and close your fist or perform the exercises that you may have been prescribed. You could use a wax bath if you had access to this. A lot of people find that quite comforting. You may have seen these little reusable gel hand warmers, which are available on the high street and online, and they work by clicking a little disc and they stay warm for about an hour. So they can be really nice to use if you are going for a walk or if you were watching a match from the sideline. There are also rechargeable battery hand warmers, widely available online and in shops as well. If you're taking clothes out of a tumble dryer, why not time it right and maybe wrap your hand in a warm towel and sit for 10 or 15 minutes, and this can achieve a nice deep heat as well that most people tell us is quite comforting. If cold weather is something that particularly aggravates your symptoms, it is really important to be proactive about wearing gloves, just normal winter gloves. Your OT may advise use of isotoner gloves, which we'll speak about later, but just having lots of pairs of normal gloves that you use day to day can be helpful. And if you get into the habit of leaving these stored on your radiator or in your hot press, you can also get added heat benefits from that. Many people find that compression can also provide support to swollen or painful joints, or if the joints are irritated, that it can feel quite comforting. Your OT may advise use of compression gloves, sleeves, or wraps. For example, this is an isotoner glove, which provides nice support to the hand and thumb area. And in the images shown, you will see compression for individual digits or joints, which can be used specifically for which joint is affecting you. It's really important that compression is never applied too tightly, so your occupational therapist will advise on the correct product for you. There's also some evidence to say that kinesio tape can give some symptomatic relief in the case of osteoarthritis, so your therapist may trial an application of tape for you as well. So for the next aspect of treatment, Susan is going to help me demonstrate some of the splints that are available. So your occupational therapist may advise use of splints to help with your symptoms once you have been assessed. So just to show you some examples of what different splints are available. So for example, this small fingertip splint can help with osteoarthritis at the DIP joint at the tip of your finger, and it could be worn at nighttime for rest, or it could be worn during work to relieve the strain on the joints. There are other off-the-shelf splints, such as this black one that Susan has on, or this grey one that I have here, and these are prefabricated splints that can be used to support the CMC joint at the base of the thumb, again maybe in function to relieve the strain on your joints. We can also provide custom molded splints, such as this blue one or a thermoplastic version of that, if the prefabricated splints don't work for you. It's important that the splints are worn as directed and not overused, because it is important to keep the joints moving as well. And that moves on to the next aspect of treatment, which is exercise. So once your pain is well controlled, your occupational therapist or your physiotherapist may prescribe you some exercises to do. And these are generally very gentle exercises, and the focus is on maintaining mobility and increasing the strength of the muscles around the affected joints to help with the stability of the joint. So knowledge is power. So by taking the first step to watch this video today, you've started the process of taking control rather than feeling that your arthritis is in control of you. As OTs, we aim to assist you to become your own active problem solver, because in your home or your workplace, you will find unique challenges, and we aim to assist you to solve those challenges yourself. We will talk a little bit more about this in our next video. Talking about how you're feeling can be really helpful too. So whether that's to a family member, a friend, a therapist, whoever you like to chat to, can help you to process and normalize the feelings that you're having. Relaxation and meditation can be useful, and there are lots of resources online, in your library, in books, and your OT can help you through the process of accessing some of those resources as well. Exercise is a proven way to boost your mood, and if you find an exercise that you really enjoy, you're much more likely to sustain it. If you're unsure or nervous about exercising, talk to a physiotherapist about where to start, and keep an eye on arthritisireland.ie, where you will see advertisements for local exercise classes specifically for people with osteoarthritis. This can be a really nice place to start. And finally, have a think about what are the valued activities in your life and how you can prioritise them while proactively managing your symptoms. So for example, if you love gardening, but you're finding that it's becoming less pleasurable because your hands are sore, you may decide to just use a splint consistently for that activity, or you may decide that instead of spending 1 hour in the garden, you spend 2 half-hour slots. So we hope now that you have a little bit more information and understand a bit more about what osteoarthritis is and how you can manage it in your daily life. We'll move on to look at a little bit more specific information about how you can use your hands in a smarter or a more clever way when you have osteoarthritis. And we would invite you to look at our next video, Living with Arthritis, How to Protect Your Joints in Function. Here we will show you a plan B, maybe a new technique or a new habit that you can put into place in your daily activities. While you can't reverse the changes of osteoarthritis in your joints, you can consistently make these small little changes that will minimize the impact of your symptoms long term. For more information on osteoarthritis, we recommend that you visit the website of arthritisireland.ie. There's loads of great information about different types of arthritis, treatments available, information on physical activity and healthy eating, and lots of local information about events, courses, conferences that they may be running. So we hope you've enjoyed our video today, and we hope that you enjoy our next video, and thank you for taking the time to watch.